Hey everybody, this is Dr. Gabe Frank, and we are going to do a video about the proper way to do an intramuscular injection for your testosterone treatment. So this is probably one of the most common questions I get is how do I do an injection? And I figured that doing a video showing me doing an injection, how to draw up the medicine, how to do it the right way. It's very simple, but as I tell my patients, it just has to be done the right way. So your prescription will come with everything that you need, the testosterone, needle, the syringe, the 18 gauge needle, you don't want to inject with that, the 25 gauge needle, which is the one you want to inject with, and then the alcohol swabs. So this is the setup that I do personally. I'm going to show you literally the exact way that I inject myself. So first thing you do is you take one of the alcohol wipes, open it up, and you want to clean the top of the bottle. You want to take the syringe, and it's set up real nice for you. This top part will kind of unfold. Pull it down and grab it by the back because the part where the screw part is sterile. So you take that, open the 18 gauge, the pink needle, open that up. Again, keeping that sterile part untouched. Screw that right in there. And that is why you don't inject with the 18 gauge. That hurts a lot. You take the cap off, and you will see that the bottles of testosterone that you get are not all the way full. So we want to go ahead and put right in the middle. And for those of you who are dosing at 0.4 or 0.5, you'll see 0.5, 1, and each of these little hash marks are 1/10 of a cc. So if you're injecting a half a cc or 100 milligrams, you're going to pull it back to the 0.5. And you'll see there's an air bubble in there. That's totally fine. Just kind of work that back up. Draw it down. The top part of the plunger is at the 0.5. Go ahead and take the bottle off. We're going to switch needles, put the cap back on, unscrew it. We get our much friendlier needle. Open it up, same thing. Go ahead and screw it on. Now this is where we'll go ahead and do the actual injection. I injected my testosterone yesterday, so I'm not going to do any more today. Go ahead and open the alcohol wipe. Now, there's a couple different places you can inject. I personally inject in my quads. You can also inject in the top part of the butt. I'll show you how to do both. So the quad muscle you want to inject is this big quad right, that big muscle of the quad right there. So anything, this is the middle of the leg. Here's your IT band. Anywhere in here is totally fine. So what I'll do, so there's two things really to remember when you're doing this injection. One, keep that leg as relaxed as possible. Sit on the edge of the bed, sit on a chair, whatever. Just keep that leg kind of relaxed. And then you want to go perpendicular to the skin. You want to go like this. Very common error that I see is guys do that. You don't want to do that. Perpendicular to the skin, just like that. So you go ahead and you would clean the skin. You would take the cap off, and I will take a nice big chunk of muscle, because the harder you squeeze, the less you feel the needle stick. So squeeze, 1, 2, 3. Inject it most of the way, or insert the needle most of the way into the skin. Move your hand up and inject. Now you will see that the testosterone is rather thick. So another common error I get is guys do the injection and they try to push it in with their finger. What's going to happen is you're going to push, it's going to shake, and you're going to get some bruising. If you put the needle in this way and then move it up like this and inject, it's much easier. So that's kind of into the quad. The second place you can inject is the top part of the butt. I actually don't inject because I have trouble getting to that area. But if you have a wife, if you have someone who can inject for you, I recommend back here. Same thing, you want to make sure this is relaxed as possible. So you actually kind of lift that leg up. And the same thing, right at the top part of the pocket, right there is where you want to go. Same thing, you go 1, 2, 3, inject, push, there you go. That's how you do an intramuscular injection for your testosterone. Again, if you have questions, 910-679-8534. You can email at askdrfrank, ASKDRFRANK, @frankinstitute.com. You can visit our website, www.frankinstitute.com. Thank you.